right, I think we are going to go ahead and get started, and I'm sure others will join, but thank you, everyone. Happy Hispanic Heritage Month. On behalf of the UNM Health Sciences Center Office for Diversity, Equity, and Inclusion, we want to welcome you all to such a great presentation. And we have two leaders within our state that are going to speak a little bit more about the impact of how mental health is impacting our Hispanic, Latino, Latinx communities. Before we get started, I do want to see if our wonderful Vice Chancellor, Dr. Val Romero-Leggett, wants to say a few words. Dr. Romero-Leggett?
Hello, Dr. Gomez-Chavez, and thank you so much for the opportunity. I'm sorry I'm not joining you all by video right now, but I'm not saying I'm unstable, but my Wi-Fi is unstable. I might be a little bit, but I'd rather make sure that I can hear everything. But I just really want to thank you all for being part of this incredible month and this celebration and this honoring. To really thank, of course, Dr. Gomez-Chavez as one of our leaders and Dr. Sanchez as well. But we have an incredible team here with Teresa Madrid and Jose. And I know I'm Rodriguez. I will forget people if I start listing, but it's always a team effort. And just so proud that we have such rich heritage and culture and that we can celebrate and honor here together. So thank you for that. And I'm very proud that our Office for Diversity, Equity, and Inclusion is able to work in collaboration with so many of our wonderful partners and people to be able to have these heritage months now and celebrate in this manner. So thank you for joining. And again, I'm excited to be part of this today. Thank you.
Thank you. And with that said, I'm going to go ahead and do introductions of our speakers. So today we have Mr. Fred Sandoval, who has over 30 years professional experience in the health and human services. Mr. Sandoval works as the executive director for the National Latino Behavioral Health Association. And under his leadership, he operates both the National Hispanic and Latino Addiction and Prevention Transfer Technology Centers, as well as strategic prevention framework partnerships for success programs. He oversees the behavioral health interpreter and promotores de bienestar training programs. And he has been appointed to serve on the New Mexico Medical Board of Examiners, Neuropathic Doctor Advisory Council by the New Mexico Supreme Court. He also recently presented as a thought leader to the Satcher Health Leadership Institute Data Consortium and the Congressional Hispanic Leadership Institute on Latino mental health crisis. And I have been most impressed with his recent Facebook Lives, which are called Platicas, and they're called Latino Wellness during COVID-19 and Tenemos Voz on Peer Recovery. He was also a part of the Richardson administration and served in a cabinet level position. Thank you so much, Mr. Sandoval, Fred, amigo, for being here today with us. And now I'll move on to Dr. Villalobos. She is currently the NLBHA co-director for the SAMHSA funded Addiction Technology Transfer Center. The NLBHA, which is, of course, that stands for the National Hispanic and National Latino Behavioral Health Association. She is a program director, and she's also serving as the SPF Director for Northern New Mexico. She received her doctorate degree from the University of Texas, El Paso, and her professional background includes a 15-year career in public health, working for clinical, academic, and nonprofit public health agencies focused on mental and behavioral health disparities among Hispanics. She is a 2021 graduate from the National Hispanic, Latino, and National Latino Behavioral Health Leadership Program. That is fantastic. Dr. Villalobos represents NLBHA as a cultural broker for the National COVID-19 Resources Network, funded by Morehouse University, in helping to bridge current information regarding the COVID-19 virus to Latinos that live along the US-Mexico border. So thank you again for both of y'all for being here. I know those introductions were a little bit long, but I think it's important for us to highlight your wonderful professional and academic experience that you bring to this important topic. So with that said, I turn it over to the both of you.
Dr. Gomez Chavez, thank you for that introduction, and I'd be remiss not to also say thanks to my colleague, Dr. Valerie Romero Leggett, and of course to El Doctor, the esteemed Dr. Lawrence Royval. So thank you very much for this opportunity. Myself and Dr. Villalobos were looking forward to this, and I, like you, of course, am very excited about the fact that we're able to celebrate Hispanic Heritage Month. And you put me right in the right space by playing Música Mexicana just during that period there before today's session, because in part, it talks about those things that make us feel good, that are good for our well-being. And guess what? Music, part of our culture, is in fact one of those factors that does that. So that was a great way to kind of stage us starting today. And we appreciate greatly the opportunity to make a presentation today. And we're going to tag team on this effort, because what we'd like to do is, speak to something that's very important to Latinos in our nation right now, and that is their well-being. And you're absolutely right. We do monthly platicas, and we have these conversations about Latino well-being. And if you notice that we use that phrase rather than mental illness or mental disorder, because part of the narrative really is about the things that we do right, the things that we are doing to take care of ourselves and our family and our communities, because really we'll know that in large measure, Latinos have lots of positive, proactive, and protective factors that take care of them and their families. And so we certainly want to highlight a little bit about that today. But of course, as with any session, we do have a PowerPoint to present with you and to you and for your all benefit to hear about some of the things that we're working on. And so we're going to get started, and I want to introduce the organization just a little bit. So in terms of the next slide, what I'd like to do is highlight who the organization is. During the President Clinton administration, under the tutelage and the leadership of the SAMHSA administrator, Nalba Chavez from Tucson, Arizona, she was the executive director for the community mental health center there called La Frontera. She helped to lead the formation of the National Hispanic Mental Health Congress. I was part of that 180 cohort group of Latinos that came together to talk about Latino mental health. And it was a first, and has been so significant to the work that you're going to hear about today. Well, one of the recommendations was to form a National Latino Behavioral Health Association. And in fact, one was formed, and that's the organization that I currently work for. And it's very telling that in the year 2000 to the present, what we've learned. And sure, you're going to hear a little bit about what we've done and what we know and what we'd like to share with you. So I just want to highlight that about our origins, if you will. So next slide, please. So if we start to think about the organization, and I'm not going to go into details here because we really have some really cool content that we want to share. Our mission basically is to help to influence the national behavioral health agenda in the United States. But we don't work just at the national level. We also work at the state level and even at the local level. So we get to hit all tracks, right? The macro, the meso, and the micro level, because Latino behavioral health is needed at every level of our nation's effort, particularly as it relates to policies, because policies determine what is going to happen, right? So we want to be able to address that and influence that. And we do that in a number of different ways. And our organization has really tried to take a leadership role in addressing these disparities so that we can help inform policymakers and leaders about what can be done different that helps to improve the system of care for Latinos with behavioral health conditions. And first and foremost, before I go to the next slide, I really want to say that the narrative should oftentimes be more about our well-being, because mental health is talking about that emotional status of our well-being, right? So not all of us are experiencing mental health issues or disorders or conditions, because the vast majority of us are in fact achieving a good mental health status. And I want to make sure we put emphasis on that, because even though we'll show you statistics that show us what's happening at the end of this other end of the spectrum, we also know that on the opposite side are all the things that we are doing that in fact does take care of our mental health. So that's really important. We don't want to lose sight of that, because it talks about something that's unique to Latinos in this country. Next slide, please. So what I'd like to share is we have 6 priorities, and I'm not going to cover these in any detail, but it helps any listener, anyone from outside the organization learn about what we're currently working on. And here they are. These are the policy priorities we're currently addressing as an organization from 2020 to 2025. And this in large measure represents the strategic discussions we've had about what are the most significant issues that we need to focus on. So our mission isn't only to address these disparities, but then the priorities are to then take action steps. And so this kind of gives you a sense of those things that are most critical to the Latino community. And having said all of that, one of the things we're doing in about a week is we're going to align our priorities with the priorities of the Substance Abuse Mental Health Services Administration. And there are so many parallels there. But anyway, I want to just go on to the next slide just to share with you that here we are, an organization that happens to be located in New Mexico in terms of its central office. And that's really very telling, right? Because we originally were in Washington, D.C., and I was hired as the operations manager. And I said I was not thinking of moving to Washington, D.C., even though there was an opportunity to do that. And I've been working from New Mexico since then to form our organization. So in the last 4 years, we have really taken a significant leadership role in our nation. We currently operate the National Hispanic and Latino Addiction and Prevention Technology Transfer Centers. These are training and technical assistance centers that help organizations who serve Latinos to learn more effective measures and approaches for serving the Latino community. And we have a cadre of consultants throughout the nation. We really have the benefit of working with just about every content expert around the continuum of care and the lifespan that relates to Latino populations and their behavioral health needs. And so we're very proud of our managing those 2 centers. And in fact, Dr. Villalobos will talk a little bit more about her role in relationship to that center, because she's now the co-director for the Addictions and Technology Transfer Center. Next slide, please. So here are some things to be thinking about. When we were asked to do this presentation, I realized that the mental health conversations for Latinos today is very different than they were a generation ago, in large measure because of what's happening in our nation with a pandemic that has altered the landscape tremendously. Today, last week, last month, last year, and it'll have long-lasting impacts for many years to come, and hopefully not so much for decades, but for years to come. But I did want to share just very briefly that there's some issues happening today that are impacting Latinos and their well-being, and we want to highlight a little bit about what that is, because it really tells us that this is the experience that impacts people's health and mental health, right? And so we are learning that because of COVID, that it is particularly having a very dramatic impact on the things that are very related to basic necessities. And it's because of what has happened to essential workers in terms of the impact of lost wages and employment. But then there comes the challenge, right? The stressors of paying bills and the ability to feed your family. Very basic, but it's really creating stress levels that weren't happening before the pandemic to quite the same degree. there has always been high levels of food insecurity and even obesity, for instance, that impact people's nutritional health. But we also recognize that this happens across all groups, some more disproportionately than others. The Latino community, of course, now, particularly because of COVID, is having increasingly more difficult times paying for medical care. Even though the Affordable Care Act helped ensure reducing the uninsurance rate for Latinos, being part of that effort, NALBA was called a champion of coverage because we help to train organizations on how to get uninsured Latinos insured in the Affordable Care Act programs, right? Medicaid expansion, et cetera, et cetera. And we actually reduced the rate of uninsured populations in the US, but we're still now experiencing some issues that really impact Latinos because guess what? When you're impacted with COVID itself, it has a dramatic impact. And if you don't have insurance or have lost your insurance because of the loss of employment, you can now start to see that the multiplier effect is just tremendous, right? And so really I want to just end on this page here talking about the psychosocial stressors. Stress is a daily experience, right? But yet on the other hand, there are some stressors that when they're not mitigated or aren't addressed can become problematic. And as they escalate or increase in nature, that distress and duress, in fact, will have long-term impacts. Next slide, please. So having shared a little bit about this, here's something that really kind of puts in perspective what's going on with the Latino community today. And this is both a combination of the mental health aspects, those things about our well-being, and then those issues having to do with mental health issues and problems and illnesses and disorders. So we know that Latinos are making huge leaps in bounds of our population growth. So we're almost at 19%. It won't be long before we're at 20%, making us 1 in 5 individuals who live in the United States. Very dramatic, very significant. Of those Latinos who are in the United States, 16% reported having a mental illness in the past year. So that tells us something. That tells us this. One, there are individuals who now are seeking help. There are those individuals who have gone undiagnosed are maybe getting diagnosed and thus treated. And in other words, now we're starting to see Latinos do something that's very critical. That is seeking mental health services when appropriate or when needed, right? But we also understand that this means these are large numbers of individuals, 10 million. So that means this creates opportunities for the healthcare system to address our needs. Next slide, please. And I'd like to just highlight something if I can very quickly, so that while Latinos, in fact, are experiencing mental health issues, there are vast numbers of individuals who are experiencing well-being and recovery. And that's so critical, right? Because part of that, what that means is we're attending to the things that take care of our emotional health, particularly, right? And that's actually influenced by two things, our physical health and our spiritual health. All of that represents really the kind of the concepts behind well-being in the Latino community because of the cultural aspects of seeking help, the cultural beliefs and values about taking care of oneself and taking care of the family, right? So in this slide here, what we're going to do is we're going to show you that, in fact, that while COVID has altered the scheme of care, the impact it's having on providers, the system of care, and the frontline staff in healthcare agencies and providers, including the University of New Mexico, for instance, we know that you're confronted as professionals with these issues because you see them firsthand. So for those of us who are looking to address these issues from a research or policy or advocacy perspective, we're taking quick notes and study about what the impact is on Latino and their mental health. And so you could see that what has altered in this COVID experience is the impact that it's having on the Latino community. And we want to share this because we know that the numbers have been extraordinarily high for Latinos and African Americans, and for reasons that are very telling about the disparities that existed before and what it is about the challenges and barriers that exist today that have been exacerbated because of the fact that there are still access problems and access issues. But I just want to end with this. We wanted to highlight something that's very impactful for Latinos right now. And that is that in our traditional modes of grieving, they have been significantly altered. So now death and grieving, which we take very serious in terms of the practices and the rituals and the approaches for helping our families grieve, have been altered. And here we identify some of those examples here of what has been altered. And this is going to create this prolonged grieving challenges for bereavement. And I just want to end with this page to simply say that while we're also trying to explain the loss to children, this is what it's doing also. It's creating a higher number of children who are orphaned. And so this is going to be very telling. It's going to put pressure in our communities for how to take care of those children. In New Mexico, we have a very old method and system of care for orphan children. It's called compradasco. And compradasco is where the godparents then raise the children who have been orphaned or who have been lost because of the losses in their parents or grandparents. So as you can start to see, this is something that's challenging New Mexico, our communities, and the nation. So next slide, please. So just if I can very quickly here, this mental distress that's taking place is impacting New Mexico, right? So we see that the adults who are reporting poor physical health and the stressors associated with isolation, the pressures of losing income, it's causing parents and adults to struggle now even more so, which means children are witnessing that. And what I want to just simply say about this is that, there are some situations such as mental stress and mental problems and issues that are situational. They will happen to any one of us at any given time, right? Well, then there's those situations where things can become an illness and a disorder, much more serious in nature. But given those contrasts, we also have to remember that in that continuum, there are those folks who are still working hard at managing their stress to address those kinds of issues. But we're seeing that Latinos are taking advantage of screenings for the circumstances that they have, particularly with their providers and mostly in community health centers, because in large measure, that's a very stigma-free associated environments, which Latinos like, right? But I did want to share this very quickly here. So we do see that Latinos are seeking services, right? And particularly for mental health, 61% of Latinos are receiving treatment for mental health issues. Where there's a real contrast is with Latinos who are not getting treatment for substance abuse. 9 in 10 Latinos in the United States aren't getting access to substance abuse treatment. And you can tell, right, with substance abuse issues, it's going to affect people's mental health, as well as, guess what, their overall health status. And the end result is this, is that we're seeing that there's very little access to treatment for Latinos, not just in our state, but in other states as well. But overall, we're in a crisis. And it's important for us just to call it what it is, right? Let's make the invisible visible, right? So next slide, please. So as I approach kind of wrapping up my slides, because I want to have my colleague, Dr. Susie Villalobos, also share what we've learned in terms of the mental health impact. Here's something very significant. It's the impact on the children in our families. And most of us know, because we hear this, we have children of our own, we have family members with their children, and our deep devotion to family, right, means that in fact, we take to heart the things that impact our children. And so we're finding that children now are experiencing disproportionate amounts of stress to such a point that what used to be their well-being now is becoming an issue, and in fact can and could very likely contribute to conditions. And so the reason I bring that to our attention is for this reason. Here's what we know about mental health in general in the field and what impact it has on the youngest sector of our communities, i.e. our children and young adults. So here's what we know. We know that 50% of all lifetime mental illness begins by the age of 14 here in the United States. So let me repeat that. 50% of all lifetime mental illness begins by the age of 14, as it is, right? 75% of lifetime mental illness begins by the age of 24. So we see that those first 25 years of our life experiences, which are the children, the youth, the young adults, they will in fact tell us and be the measuring stick for our ability to effectively serve our children and our communities, because these children become young adults, become adults. But we also know that individuals whose need for mental health services go untreated will in fact create greater problems and thus greater disorders and conditions in later years. So next slide, please. So as you can see that I'm really getting ready to wrap up, and we certainly know that because of its impact on children, that take a look at how your organization is currently addressing that for all children, but recognizing that in the Latino community, they're going to be getting less access to care. And that means any opportunity you do to have to serve them means that their family members and those in their extended families or in their extended network, because in the Latino community, our networks are so closely tied to our well-being because we use those natural support systems for information gathering. We get them in order to find out where resources are available. That becomes our source of information. But it's also the ways that we use to help mitigate and reduce our stress is to find those natural support mechanisms. Next slide, please. So as I now wrap up, I want to say thank you for giving me the opportunity to share some of this information in quick order, but I'm really trying to along with Dr. Villalobos, kind of give a perspective of what is transpiring in our communities, our state, and the nation, because the system of care is what operates above all of us. And we oftentimes don't get to design the system of care as much as it's being designed to serve the needs of people who need services. However, we know that many of the services that are being rendered to Latinos are one size fits all. And oftentimes there are some approaches that are effective for us, and then there are others that weren't designed for us. They weren't normed for us. And the end result is that we still see a great need for having approaches that are designed for Latino communities. So that if there's a future for us, it's to disaggregate the data and develop programs, research, and then through design and implementation that's financed in order to help us have the types of programs and practices that are effective for addressing our issues. So Dr. Villalobos, thank you for jumping in here. And I know with your background, you'll be able to share all of this in such a way that it'll be informative and not feel overly scholastic, but I know that however you do that's going to work. So thank you, Dr. Villalobos.
Thank you, Fred, for that introduction. And I want to take a little bit of time to thank Dr. Gomez-Chavez for the invitation and for having both Fred and I on today to be able to really highlight some of the work that NALBA is doing. I too have had my eye on NALBA for quite a long time. I'm barely 6 days on the job as of today in the NALBA family, and I'm very excited to be a part of such a high quality, high impact organization. And in doing so, I just want to take a few moments of our time to really look at some of the data that drives NALBA's work and some of the products that they create for our Latino communities and our Latino families, particularly around the issue of mental health. One of the things that NALBA does very well is communicate not only at the federal and state level, but really gets down to the grassroots and works with communities who are really suffering with issues of substance use disorder and mental health issues. Here we're showing just a snapshot, and I'm not going to read all of the data here. I'll just give you the high points from our epidemiological assessment report from 2019. And here you can see that there's frequent mental distress and current depression in our 2 counties that we currently work with our strategic prevention framework. This is derived from the data that is collected for the community to make decisions on some of the programs that NALBA will help in assisting for mental health. And if you'll notice, one of the higher rates in Rio Uribe was 16.9 and 16.8 for our Hispanic with frequent mental distress, which is really what Mr. Fred Sandoval was discussing about the New Mexico population. Our next report, and kind of where Fred ended, was looking at youth mental health in 2019. And this comes from our same assessment in working with our 2 communities of in Santa Fe County and Rio Uribe County, and comparing it to our national and New Mexico data. Here you can see that suicide is a serious and persistent public health problem in New Mexico. Over the period of 1981 through 2018, New Mexico's suicide rate was consistently among the highest in the nation at 1.5 to 1.9 times the US rate. You can see in this table that their indicators for our youth mental health are reported for both the counties as well as for statewide and nationally. And it's self-reported feelings of persistent sadness and hopelessness, which we've seen consistent with during the pandemic, as Fred mentioned. We also, if you, some of you are not on the screen, but we also included our NALBA high schools, and those have higher rates of persistent sadness and hopelessness, which is derived from the YRRS data, and that is at 36.5%, which is right around the same rate as the national rate for persistent sadness and hopelessness. So some of the services, and this is really where NALBA does a lot of great work, is those resources in supporting the Latino communities. We really work with our grassroots and community health workers, also known as our promotor networks. We extend those services to our rural communities with our strategic prevention framework, as well as with other programs and research projects that I'll discuss in another slide. We do a lot of the dissemination and factual COVID-19 vaccine testing and information that's translated from English to Spanish, as well as Portuguese. And we really leverage our community-based organizations as collaborative partners to offer that prevention, access, and treatment for behavioral mental health conditions. And really what that means is NALBA's really good at identifying those CBOs that are really down in the mud and working with those communities that need our help and are really suffering. One of our partners in Florida, Mr. John Martinez, who has a very high impact CBO, really gave us a snapshot of some of the work that he's doing in Florida and some of the services that he's really needing around this issue of mental health for Latinos, for his immigrant population, and for his farm worker population. So those are the kinds of conversations that Mr. Sandoval has with his CBOs and some of the services that NALBA is able to offer beyond those communications. And we also offer services for our non-English speaking minority groups. As I mentioned, we translate and interpret all of our information in those 3 languages. One of the projects that I'm a part of, which is this WEAVE New Mexico wide engagement for assessing COVID-19 vaccine equity, is with some community investigators that may be well known to you in New Mexico, such as Dr. Linda Kakari Stone. And she has this project where they're looking to fill a gap in the nation with diverse racial, ethnic, rural, and underserved resource communities in New Mexico and the US. And really they're looking at how can we change this conversation? How can we change the narrative? How really the narrative has been that minorities and Latino communities have been hesitant to take the vaccine. But in reality, there are really other things at play that Fred mentioned earlier. This real inequity of access, this inequity of understanding some of the additional negative consequences of COVID, and not being hesitant, but not really being able to access testing or vaccination. So I'm not going to go through all of these challenges, but I think there really is a need for this data transparency and sharing and collection by race, ethnicity, and geographies. If you notice, some states haven't been able to share their data across ethnicity, which I think is very important when you're looking for areas of programmatic change, for advocacy, and for policy change. Some of the WEAVE activities collaborative with NALBA include mitigating the spread of the virus in Latino communities. And how do they do that? Well, we've engaged with our grassroots promotoras. We're training them to be part of our workforce. And in doing so, we're also paying them a working wage to collaborate with us, not only in understanding the project, understanding how research is done at the academic level, but also training them on how to do survey recruitment, how to consent individuals, whether it's on hard paper or whether it's on an iPad. We're also letting them do this type of conversation where they're having a life coach in case they are engaging in a conversation that may bring up other feelings for them where they've experienced some negative consequences of COVID. We're taking care of them as well in that sense and having them have access to a life coach. And also part of our NALBA activities, we're doing this narrative storytelling where we're using digital stories and catalyst films to uncover the complexities of lived experiences of New Mexico's rural and urban Native and Latinx communities. And really that's going into touching how not only, and Fred mentioned it, we are resilient a population, we're a resilient Latino community and Latino people. And I think that story needs to be told not only throughout New Mexico, but as well along the border. And that's where NALBA is really doing that collaborative weaving of the, not only of the story of the grassroots individuals, but those that live on the border and also up in northern New Mexico. So in able to really disseminate this information on COVID, NALBA has created a NALBA COVID-19 resource page. And if you're on the phone, I'm sure hopefully you'll be able to access this information and go to our website, which you can find at nlbha.org. And then you can just type in COVID. And there we offer a myriad information with regard to our WEAVE project. We also have resources that will refer you to mental health services, also areas of where you may be able to find testing. So we invite you to visit our NALBA page and especially our COVID-19 resource page, which I believe is also in Spanish. Is that correct, Fred? Yes, it is. I see him shaking his head, so he says yes. I didn't want to speak out of turn before I said that. Thank you. And there you can also find what we call our COVID-19 fact sheet, and it is available in English, Spanish, and Portuguese. And there you really find where we've really compacted a lot of this information and resources with regard to the facts surrounding COVID-19, some of the stressors that Fred and I have discussed, and really the science and the research behind the vaccine and the pandemic, and then providing some solutions for those communities and families who've experienced these negative consequences from COVID-19. So again, if you go to our website, you would be able to download this COVID-19 fact sheet. One of the things that I experienced yesterday being new on the job with NALBA was being able to experience these scholarship recipients receiving their notification and news that NALBA would be supporting them in their pursuit of their degree in a Master's of Social Work or even a doctorate in psychology or psych science. And from that scholarship program right now, they have a track record where 97% of their graduates graduate with a behavioral health degree in New Mexico, which I can't believe. It's just really outstanding what the work NALBA is doing with these scholarship recipients. And it was a very moving ceremony. And I invite you, if you can, to really go and look at our website and understand more of the Josie Torralba Romero Scholarship. And she was our first president for the National Latino Behavioral Health Association, and the scholarship was created in her memory. And now we're adding on more scholarships where we have additional partners and agencies who want to help out these Latino students finish out their careers. So we invite you again to our website to check out this scholarship and also be able to nominate students who you think would be worthy of receiving a scholarship from NALBA. And finally, we have some additional resources that we'd like to share with you that are also on our NALBA webpage. There, the CDC, where there's COVID conversations, answering questions, information about COVID-19 vaccines, and again, answering patient questions, which you all who may be familiar with as clinicians. And then finally, Fred and I really wanted to take some time to really filter some questions you may have about NALBA or some of the services and products we offer, or how we may be able to partner with any of you on any of our programmatic activities. So I think I'll go ahead and open it up. I'll stop sharing the slide and have Dr. Gomez Chavez chime in here, and maybe we can filter some questions, Fred.
You bet.
Yes, sounds good. So first of all, thank you for an incredible presentation. You know, as I think about my own family, going through COVID, losing my dad, I couldn't even be there because He was there watching my children having to, be at home learning, being isolated. I mean, we were just experiencing, and you presented it so beautifully. Like, I couldn't really understand why we felt so disconnected, and why I'm still not fully done with the grieving process is because you're right, we were not culturally, we've taught how to cope in different ways and be there for our families and be there for our kids. But it's thank you. It was such a powerful presentation. So thank you so much. I know it helped me better understand where I'm at and my mental health, right? And I think all of us here, we still haven't been able to fully process what we just went through, being at home, disconnected, and then also helping our children, our families. So I appreciate you all. Are there any questions?
Good afternoon, Dr. Gomez-Chavez. I truly appreciate this opportunity. First of all, I want to thank our Vice Chancellor, Dr. Romero-Leggett, for her leadership to move our Heritage Month initiatives forward. And thank you, Dr. Gomez-Chavez, for your leadership along with Dr. Sanchez to lead these important initiatives. Let me mention that during the last couple of years, I truly appreciate that our community partners have elevated their efforts through various platforms, including social media, to be able to engage numerous partners statewide, nationally, and globally to be part of important dialogue regarding critical issues. I have been part of numerous conversations with our partners, and each and every one of these partners are truly committed to making certain that there is greater awareness and that we're providing resources for our communities to move forward in ameliorating these challenges. So I'm truly grateful to Mr. Sandoval and Dr. Villalobos for this very important presentation. And I want to commend the National Latino Behavioral Health Association for their many dedicated efforts. So thank you again for this extremely informative and valuable session. And we're grateful for your contributions to continue to make a difference in our communities.
That's thank you so much for your comments, Dr. Reyval. It makes us very proud to hear that feedback, because it's important for us to hear the feedback. And I want to do a little flashback here. We had a live Facebook Platica with our esteemed colleague, Dr. Romero-Leggett, some time back. And we've continued to do these monthly Platicas because it's the conversation, the dialogue that we want to have with the Latino community about us, so we can address those things and have that collective experience about how do we problem solve or address the things we're all experiencing. And Dr. Gomez-Chavez, you were so kind to share your personal experience, and que en paz descanse tu papá, because part of that is where Latinos started to immediately be impacted was not to be able to be with their loved ones at the hospitals, particularly, right? Which meant we were communicating with other people to our loved ones. And that was so painful. It was just so painful because it interrupted a tradition that's thousands of years old. It's called the despedida, right? We lost that and we can never regain that. And we're hurt by it. We're not just hurt by the loss, but we lost that practice during the period of COVID. And today it's affecting many of us because it's prolonging bereavement. It interrupted it. And then there's some parts we can't get back. But the healing process gets discussed in our pláticas because we want to be open about making the invisible visible. Porque cuando sufrimos, se queda dentro. Cuando nos despedimos, we get to release that. See the contrast, right? Porque todos sufrimos, all people suffer. Humanity, all of us in humanity suffer. But it's the fact that we release it, which is a mechanism for relieving distress, is to experience and share what we're feeling with the loved ones who are hurting. And so thank you. That was such a strong personal disclosure. Bless you for saying it, because this is exactly what we can do and will need to do more of, because in part, we're going to do a collective healing of Latinos in everything we touch and do, because we have to mitigate this situation. We have work to do, and I know you all are there supporting us in the ways that you do by attending us. So Dr. Romero Liggett, all I can say, you always leave me inspired, because as a MD, I mean, who knows this better than yourself? And all I could say is you've got a fan club here. So thank you so much.
Thank you so much. Are there any other questions?
I think this Dr. Romero Leggett, I did have one question because it comes up a lot, and I think you answered some of this today, and especially this now the conversation at the end. But people, again, we try to think also preventive, right, is so important for all of us. And I guess I would ask you, Fred, Director Sandoval and Co-Director Villalobos, if you had to pick your top 2 or 3 things that you felt how for us to maintain healthy mental lifestyles right now, what would those be? And again, I think there were some in here, but if you chose your top 2 to 3, what would those be?
Oh, that's great. What a great question. So Dr. Villalobos and I have delved in this subject matter in different ways in different years because of our path. The fact that they intersect now and tells you a little bit about how we've been trained or what we've learned, right? And here's where I'm going to really kind of focus in on the assets, the strengths, and the protective factors of the Latino community. Because what I believe has actually helped develop the resilience that we've experienced for hundreds of years is because of what it is that we do in terms of the following. One is we continue to demonstrate our beliefs and our values for family by doing what? Ensuring that we take care of them. And then that means is that we utilize our family support system in ways that help us deal with the circumstances. That's where we get information. That's where we help get influenced in terms of our decision making. Because guess what? When we say we, who are we talking about? Well, I talked to my mom about it. I talked to my madrina. I talked to my tia about it, and I talked to my grandma. And we all agree I need to do the following. So the family support system is just so powerful. We have to continue to use it and help get information to our community members. I have found the number one thing I've learned across the country is Latinos are saying, we need more information, we need more education. That means they're being deprived of information. As basic and rudimentary as that is, I'm astonished that public resources aren't being made available to the extent that they should be. That's already tells you that's a barrier they didn't create. It's a barrier they're trying to overcome. So that's one significant factor. And then the other is this. We have to, in fact, recognize that sometimes the people who serve Latinos don't really fully understand their life circumstances. And that tells you something about the acceptability we have as Latinos about the services that are provided to us, which means is, and I'm going to use this old word, but the truth of it is it's very relevant, right? And that is, are services designed for Latinos so that they are culturally and linguistically appropriate? We know that they're not. So Latinos then are not very encouraged by the absence of agencies who are not fully trained to that, to do that kind of work. And that requires training our providers and our systems of care. And there's resistance to it in this country and in New Mexico. And we have to call the invisible and make it visible, right? Because part of that is that we still struggle there. But what can we do? We can be the educators. We can help inform people about how we understand our situation, and we can be the educators. So that's something that Latinos can actually be encouraged to do, because all the provider has to do is say, well, what do you think would really work best for you? It's really using what people would call the patient or person-centered approach. It works great with Latinos, right? Because people say, well, we can never get them to say too much. I said, well, you're probably asking the wrong question. I says, but first of all, because if you ask for their opinion, I can guarantee you they have one, and they want to say what's going on. So you have to be able to do the following. as providers, you have to master listening to the storytelling. If you choose not to listen to the story, you have just missed the opportunity to engage Latinos, because they are experts in their story and they want to tell you that story, because in there is the solution for how you could collaboratively arrive at some ways of addressing issues. Dr. Villalobos?
Yeah, I think I have to agree with you on both of those fronts, Fred. But for me, it was challenging at the very onset of the pandemic as a single mom and as a type A personality. I felt like I was losing control. I didn't have control of my situation. I didn't have control of my environment. And I worked in a clinical setting. I worked at an academic university, but that was training physicians during this time of the pandemic. And it was an 8-to-5 job. So we know now what that looks like. 8-to-5 looks very differently now than it did during the pandemic. And I was lucky enough to be able to share with Fred in the very first plática that he ever held. I was the guest, and I shared with him some of the struggles that were going on as a single mom, with school, with having elderly parents that lived in another household. So I found that I had to circle the wagons. I found I had to find information. I found I had to educate my own family, my own community, and my own people. So at that time, I had to make decisions for myself that I felt, okay, I'm not in the right position. I'm an educated Latina female, but I'm not being used in the right way to help my community. So in working with Fred, I was able to do that and take that next step. And he's absolutely right. Even living in El Paso, Texas, where I have an 85% Latino community, we were not transferring that information properly. Why? We were closing the wrong places. We were closing down restaurants, where in reality, we should have been advertising and disseminating information at our box stores where our Latino community families go grocery shopping. We needed to find new ways and innovative ways to disseminate this information. And NALBA was really doing that. So I felt that collaboratively, that was a way for me to go. And that's why I'm here now. Second, one more thing that I just learned recently 2 weekends ago is self-care. As providers, as educators, as academia, we don't step back a lot of the time when we're doing this work. And we are also living through the pandemic. So we have to take a breather. We have to identify, okay, where are my values? Where do I need to take a step back and see, am I in the right time? Because if I'm not in the right place at the right time, my parents are going to feel it. My son is going to feel it. And it just, that Latino, the family, the protective factors that Fred is talking about, the dominoes are going to fall. And I think we need to teach that to our female Latinas who are caring for their children, caring for their elderly parents, because sometimes they just go, like our promotoras, and they don't stop and take a breath. So I think the 2 takeaways is really to, yes, we need to do culturally linguistic appropriate services for our Latino communities. And 2, we need to find self-care for ourselves.
Thank you.
That's beautifully said. Any last questions? If not, we will wrap it up. I know we've gone over, and thank you all for just attending this important presentation. With that, thank you again, Mr. Sandoval and Dr. Villalobos. We thank you from our hearts for the work that you lead, because this isn't easy. And the work is, what you're doing matters. It's important. And I know there's still a lot more left to do, right? And so whatever we can do to help in this effort, we are here, and we continue to support your leadership, your activities, your programs in any way we can. So muchas gracias. Thank you for being great representatives during Hispanic Heritage Month.
Well,
Gracias, everyone.
We want to say thank you. Thank you so much. Appreciate that.
Bye. Thank you.
Adios.
Adios.
Adios. Bye-bye.
Thank you.
Bye.